I'm Dr. Warren Bruhl, and I'm going to be covering the 3 types of care that we provide here at Lakefront Chiropractic Center. The first level of care is known as initial intensive care. Usually this will last between 6 and 12 weeks. Now the key hallmark or benefits of doing initial intensive care is that it's focused on symptom relief or signal relief in the body. Usually the visits are much more frequent, anywhere between 2 and 3 times per week in initial intensive care. Now following initial intensive care, a re-exam or progress exam is necessary to determine the progress that you've made. Now most patients usually have one of three things happen at that progress exam. Some things will definitely be better in the body. Some conditions will not have changed, or some readings will not have changed, and there may be some things that actually even appear a little bit worse. Typically that's because we haven't done enough yet to get in the way of the problem, the degenerative nature of subluxation, or the patient hasn't been participating in what they need to do in terms of visit frequency, or they haven't been doing their exercises or following the proper nutrition. Corrective care follows initial intensive care, and this usually will last between 6 months and 24 months, depending on the degenerative nature of your spine and depending on the chronicity and the severity of the subluxations in the spine. Now the visit frequency might be able to be a little bit less at this point, but typically we're going to want to monitor the spine very closely and continue to do progressive exams to monitor changes in the spine. After corrective care, maintenance care is available for you as a patient. One of the things that sets chiropractic aside or differently from typical Western medicine is that we're not only focused on symptom relief. In Western medicine, most of the focus is on relieving body symptoms with medications or waiting until a condition becomes serious enough to require surgery. Chiropractic, on the other hand, is really focused on wellness, and it's necessary to maintain the spine from birth on. Now most patients, when they come into the practice, should have had their spine checked hundreds of times or perhaps even thousands of times for the presence of subluxation. But by the time they come into our practice, the spine has been, in most cases, neglected, unfortunately. Now usually those subluxations, of course, have come on from traumas. And since traumas usually recur throughout our lifetime, it makes it necessary to maintain the spine on an ongoing basis after that point. So in going through chiropractic care, it's not something that you want to think of in terms of just symptom relief only. You want to actually think in terms of wellness and what can I do to improve my health and function within my body. How can I avoid taking unnecessary medications? How can I avoid having operations? How can I be a stronger participant in my health and healing? We want to welcome you to our practice, and we look forward to taking you through these 3 levels of treatment and having you become a wonderful wellness patient who feels great and enjoys the benefits of chiropractic, not only for yourself, but for your family, your friends, and for this community. Welcome to Lakefront Chiropractic Center. I'm Dr. Warren Bruhl.